The content herein is for informational purposes only, not intended as medical advice, diagnosis, or treatment, and is not to be substituted for direct advice from your doctor.
Today's LymphCast program is proudly sponsored by VitaSupport MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit VitaSupportMD.com to learn more.
Welcome to LymphCast, the show that brings together doctors, other health professionals, and special guests to discuss lymphedema, venous disease, and other associated disorders, and what can be done if this is affecting your life. Now it's time to sit back, relax, as it's time to learn all about lymphedema, venous disease, and associated disorders on our show, LymphCast. Greetings and welcome to our LymphCast show, episode 21. Glad you're with us, whether you're watching, listening, or both. Let's go ahead and meet our panel. We'll get down to business right away. The founder of this show, also the founder of VitaSupport MD, makers of Vein Formula 1000 and Lymphatic Formula 1000, from New Jersey, physician, surgeon, Dr. John A. Chuback. Greetings, Dr. Chuback. How are you, sir?
I'm fine, Paul. Good to see you. Good to hear your voice again. Looking forward to another great show today.
All right, very good. From California, Dr. Emily Iker. Hello, Dr. Iker. How are you today?
Thank you for asking. Hi, everybody. I am Dr. Iker in Santa Monica at the Lymphedema Center in Santa Monica. Welcome, everybody.
All right, very good. Let's go back to Dr. Chuback, who will welcome in our special guest tonight. Dr. Chuback, take it from there, sir.
Okay, I'm going to introduce our wonderful guest, Nellie Bloom. And Nellie, we're already making beautiful connections here through the LymphCast because Nellie was recommended to us by Oscar and Anna, and from Omnitherapy here in New Jersey, who were some of our first guests, and she comes highly recommended through them. So we're building our network and we're passing these relationships along to all of our viewers and listeners, and hope that everyone can find someone in their area who's qualified and competent to help them with their various problems. So without further ado, I would tell you that Nellie has been working more than 20 years in the field of lymphedema. Her career goes back to 2001, and she was working at NYU in the Rusk Institute, and then later JFK Rehabilitation Center in Edison, New Jersey. And then from there, she moved on to Memorial Sloan Kettering Cancer Center, where I spent some of my training also as a surgical resident, and I look forward to talking to her about that. She was then the lead lymphedema therapist at the Monmouth Satellite, and of course, some of you may know I did my general surgical residency in Monmouth County at Monmouth Medical Center. So we have that connection as well. And Dr. Melin is going to be joining us now. That's wonderful. And as I mentioned, she was at Memorial Sloan Kettering and worked with the lower extremity as well as genital and upper extremity and head and neck lymphedema. And so we may know some of the same people there that we worked with together at Sloan Kettering. And interestingly, this reminds me of our dear friend Tammy Jarrett, who works with us at VitaSupport MD. Nellie apparently was using a sewing machine to make her own compression garments, especially for head and neck lymphedema. And I think that's something that's going to resonate with Dr. Iker, because Dr. Iker has done a lot of handmade garments and things over the years, as well as invented and designed garments. So that's especially interesting to me. And in 2021, she went into private practice, and that's when she joined Omnitherapy in Bloomfield, New Jersey, and got to know Oscar and Anna, who we know so well and work with so closely in LymphCast. And then more recently, she began working in the Atlantic Health System in a new lymphedema clinic, also here in New Jersey, in Clark. And she's both Leduc and Norton trained. I know that that's going to resonate with Dr. Iker as well. She has a great affinity there. And she's been assisting in onboarding new lymphedema therapists at Memorial Sloan Kettering, and was an ambassador for the National Lymphedema Conference in Boston, Massachusetts. So it's a impressive resume and a long and robust career. And so, Nellie, welcome to the show, and thank you so much for joining us.
Thank you for having me. Thank you for having me. I'm excited to be here.
It's a pleasure. We also have with us now Dr. Mark Melin from Minneapolis. Dr. Melin is a nationally renowned expert in wound care, vascular surgeon trained at the Mayo Clinic, and has great interest in patients with lymphatic problems, venous problems, and vascular issues of all kinds, and wounds of all kinds, and has had a very, very incredible and prominent career in that space. So I am going to pass it directly to Dr. Iker, because Emily, it seems that you and Nellie would have so much in common. Why don't you ask the first couple of questions to our guest, if you would be so kind?
Welcome, Nellie. And I think we have the same background. I also took Dr. Leduc's course.
Oh, yeah.
And I think I have to look at the certificate. I think it was 1995. When did you take yours?
It was 2001.
Wow. And it was from Albert Leduc?
No, it was
from his son.
It's Marianne who took over for the she worked right underneath them, but I think they had stopped doing it at the time. My understanding is, yeah, that Marianne took over from that.
Well, in 1995, hate to go that far back, but you know, I got invitation to join the 40th anniversary of my graduation from a medical school, and I said they made a mistake with the number. And then when I started to count, no, they did not. It's true. So yes, I was in the first course of Professor Albert Leduc, who is one of the founder of the European Group of Lymphology. And it was great honor for me to take the course, because finally I could identify my lymphedema and a lymphatic problem with my lower extremity. So welcome that you took that course, and you took additional course too.
Yes. Then in 2015, I took the intro course to Norton. I had been doing it for almost 15 years, but it was an opportunity that I had just to kind of get a different perspective on things. And so I took that opportunity.
So what got you interested in lymphology?
I think that, patient access has always been an issue, obviously. NYU was a real pioneer in New York City with the lymphedema clinic, and the Lerner clinic had closed. He had moved on to Florida, and so we sort of got inundated with a lot of former Lerner patients. And so a lot of my first introduction to the lymphedema world was with kind of, the chronic Lerner patient, the typical chronic Lerner patient. So it was a real trial by fire kind of situation. And so I took over that clinic and was trained to accommodate and to allow for greater patient access to the influx of Lerner patients at that time.
I see. And what got you interested to start sewing your own designs?
I always, when I started working with head and neck patients, it started really with them, because I hate to ask people to spend money when they don't need to. And I always kind of looked at those garments and said, I could do this. I could make this. And I had no idea how to sew, but when the clinic opened at Monmouth, they gave me a sewing machine, and I just looked at videos in my spare time and just to learn how to do it. So I had no training and no experience in it, but I had basically most of my patients got something from me, whether it was a pair of socks that I sewed, or a breast pad, or a head and neck garment, a genital pad, everything. And I sort of became known as, throughout the MSK world, was like, just go down to Monmouth, Nellie's going to figure it out. So that was sort of how I sort of had my reputation over there. And it was fun. I really liked to do it. And I was excited because, I was just saving people money. I was just like, you don't need to buy something like this. I'm embarrassed that this thing costs $150. I can make this for you. And that's kind of how it started.
You are very, very creative. Congratulations.
Yeah, no,
And
it's been
so
fun.
what kind of a patient, now you are in a private practice, what kind of a patients do you see on daily basis?
Well, actually, I worked for Oscar and Anna in the private practice until about 2 weeks ago. And I had this opportunity to be a little closer to home, and Atlantic Health opened up a facility in Clark, which is next door to me. So I kind of jumped on that opportunity. And then it was just, for me, it's an opportunity to have more patient access. At MSK, there was a limited number of Medicaid patients that we saw. And I knew at a big hospital, we could start seeing those. I could start seeing those Medicaid patients who didn't always have the ability to come to a private practice or come to a place like MSK. So I kind of feel like I'm back in the trenches again.
Very interesting point. What I also want to point out that I would say only lymphedema therapists are so very dedicated, because these patients are very challenging, and you have to spend so much time to not only treat them, but to listen to their problems, to their symptoms, their pain and discomfort. And so congratulations, and I hope that you are going to have a lot of patients, so you are going to be busy and busy.
Yeah, I know it. When I was at NYU, access has always been a problem. And there were kind of calls for us to only treat upper extremity patients, only breast cancer patients. And I just said, I absolutely refuse to not treat lower extremity. Give all the lower extremity to me, but it's not okay that we're going to deny, access to people who might not always be the easiest people to treat, but need that, like, they're just so desperate. And it's so sad that a lot of places have, especially during COVID, the access has become a huge problem, and they have sort of limited their amount of lower extremity patients, which I just think is just very, very unfortunate.
Well, in Santa Monica, and I have been here for 3 decades now, in Santa Monica, on a daily basis, we see variety of patients with lymphatic disorders. And it can be from primary lymphedema, congenital lymphedema in little babies, and head and neck. Recently, I had quite a few with head and neck, then upper extremity lymphedema patients from a variety of problems. And I would say now more lower extremity lymphedema patients than upper extremity lymphedema patients, again, of different pathology. But so I think that you are going to see probably pretty much the same once you are associated with some hospital setting where the physicians will know you and they will then refer you the patients. You are going to be very busy, especially with your surgical skill of sewing machine.
Yes. Yes, I know. I'm looking forward to it. I think it's an exciting new part of my career.
Dr. Melin has any questions for Nellie? I know you came in a little bit late and you missed part of the introduction, but I think you get the the gist.
Well, and I read your bio. Congratulations. You've had a fabulous career, Nellie. I just want to go right to wound care, because give us some tips of the trade from your perspective in your career on managing wound care and lymphedema.
Yeah, so I at MSK I had the opportunity to go and get wound care certified with the nursing. So I was wound care certified for a number of years. I think it's a real integral part of the process. I think that what I have found is that the wound care clinics and the lymphedema clinics don't always work well together. And that's what I think that it is. I think that there's a subset of people with wounds that can be served very well with lymphedema therapy. When you're getting into wound vacs and real deep wounds and infections, I think that we have to know our place too. We have to know, no, we need to pass this off. This is more complicated than we could provide. But the ability we have seen, not deep, but superficial wounds being so beautifully treated within and closing within a week or two with that compression. And I don't always know that the wound care clinics kind of understand what we do and what we could do. They always just assume, well, we'll close you up and then send you to lymphedema, but it takes so long to close up because I think they just, kind of go to their standard Uniboot for a week. And I just don't think that is the right type of environment for quick healing of wounds.
Yeah, it really comes down to understanding dermal lymphatic anatomy. And if we can help, because it's so different than venous anatomy. And, a whole nother standpoint that I'd love to hear John talk about, because John came up with this phenomenal model about talking about congestive lower extremity failure as compared to a congestive heart failure model. And it's a beautiful educational way to help people understand it. But within that context is differentiating venous anatomy with perforators and lymphatic dermal, because there aren't really the perforators. And Suami showed that obviously in his lymphosome paper in 2017 out of Australia, and helping people understand that 70% of the anatomy, 75% of the anatomy, it's in the dermis. Well, that's where the wound is. So if you get the dermal lymphatics decompressed, which is a critical component of working with our lymphatic colleagues, wounds heal very quickly, just like you were talking about. And so how do we improve that education and cover that gap between the lymphatic centers and the vein centers and the wound centers? Because all three of those entities have to get along really well to figure out how to treat, especially VLUs.
Yeah, I think that wound centers have exploded in the last 15 years. I think they're well compensated. And I think that they just don't, I don't know if they really have I mean, I don't want to, speak out of turn, but I think that a lot of times a doctor doesn't want to hear from me or kind of has a little bit of a difficult problem seeing things out of, their paradigm. And I just think that it really has to come from us putting ourselves out there and discussing with people. We do have, especially Oscar and Anna, have like a really nice relationship with the wound care people. And once you see what we can do and how quickly we can help things, not everybody can be treated by us, but once you see that, then you start kind of creating these relationships that are, a podiatrist or a surgeon would automatically just say, just go to Oscar and Anna. They're going to be able to take care of this. And it just, unfortunately, it's an access problem as well, too. I mean, you can't, if you have a wound and there's a 4-month waiting list for a lymphedema patient, well, they're going to just stick with the wound care therapy because they're going to get you in. So, there's a lot of factors at play, but I think, obviously the key is communication. And I always say the proof is in the pudding. If you send me a patient and I'm going to get them to where they want to be, you're going to send me another one.
Vein Formula 1000 and Lymphatic Formula 1000 from VitaSupport MD are backed by science and sold in doctors' offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
Two brief comments. If I could hire one person tomorrow, it would be you or your colleague to have a CLT in this clinic that's as knowledgeable, dramatically changes outcomes, right? So we're very fortunate that we have pretty good access for our CLTs here. And then the other comment was that it's education, because in medical education, and John can attest to this, Emily can attest to this, and I've got a son who's a urology resident, went through med school, his wife's in med school, my son's in med school. They're not teaching any of this in med school yet. And so physicians, I think, because it's intimidating, you end up being intimidating your knowledge base on lymphatics, and we don't know what to do with it. And so it's back to, again, that educational component to really help spread the word. John and I and Emily have talked about this with micronized purified flavonoid fractions. It's the same thing. Phenomenal outcomes with utilization of these techniques and these adjunctive aspects. And physicians just don't know the basics about this conversation. This is where the brilliance of John putting together this podcast to help educate has really done so well.
Yeah, no, I think it's essential. It's absolutely essential. And it's also, to understand my role, a lot of people don't understand what we do. A lot of doctors don't understand. And it is not always easy to negotiate a communication where I'm sort of explaining things to a doctor. A lot of people, they don't want to hear that, and they're not gonna, they're not gonna take too well to that conversation. I mean, I've been a therapist for so long, and that doesn't really bother me anymore, but I can kind of handle people. But I do like to, before I speak to a doctor, I do like to kind of gauge, where am I coming with this? Where am I going to see him on a level? Like, is he going to be able to talk to me like I'm a person? And I think the other thing that's very challenging for me in communicating with doctors is explaining what we do, because if you have, active congestive heart failure, or a kidney dysfunction, or chronic renal failure, my work is limited. I cannot provide I can't make the legs get beautiful looking or give them what they need. And sometimes I have to explain to doctors why I can't do that. Like, have you seen their BUN levels? Like, their kidney function's not where we need them to be. And what I do is push fluid. And so I'm going to overload their system. And that is another conversation that I always have a really difficult time with, because they're like, yeah, just do what you do. Just do what you do. Just do it. And I'm like, no, I really can't do it. Like, there are some patients that it's better to have swollen legs than to be pushing fluid into a system that they can't tolerate. So that's another conversation that it's the delicate one.
Well, I think, this is obviously the beginning of a fascinating conversation. And as always, I'm taking copious notes here, learning as we go. I'm sure we would know some of the same people from back in your Sloan Kettering days when I was rotating there as a surgical resident. There was Dr. Shah and Shaha in the head and neck area when I was there. I don't know if they were there when you were around.
Yeah, we had we have Dr. Diane. You know Dr. Diane?
I know the name, but didn't know personally.
Yeah.
Shaha were there, and Pat Morgan was the chief of breast when I was there. And we had Dr. Hidalgo, who was doing a lot of plastic reconstructive surgery at that time.
Yeah, I don't think they're there. I that name I'm not familiar with, and I usually know a lot of the plastic people. So
Yeah, Hidalgo was a big deal at the time. He later, kind of branched off from, he was so talented, he became a, Madison Avenue, Park Avenue cosmetic plastic surgeon.
yeah.
He was doing a lot of the really major league reconstructions with microanastomoses and flaps and free flaps and all those kinds of things of the head and neck and breast and all kinds of things. So it was a great group of people. But of course, they had a tremendously busy head and neck service and breast service. As a result, a lot of lymphedema, and I'm sure you had an extraordinary experience there. The other subject that I wanted to touch on that you touched on, and we go over these topics again and again because I think repetition is really the first corollary of education. And so for our listeners and for our colleagues, the patients who are listening, as well as our medical colleagues, we have to go over it again and again. We have a major problem in modern medicine, not just here in the United States, but more and more around the world as we develop super subspecialists like myself and Dr. Melin and Dr. Iker, and people who are getting down into the nitty-gritty, and yourself, Nellie included that. Then we begin to lose sight of the whole patient. The holistic approach becomes harder and harder to hold on to. And so when you start talking about divisions between the vein center, the vein clinic, the vascular clinic, as compared to the vein clinic, the arterial surgeon compared to the vein specialist now, versus the wound care clinic versus the lymphedema clinic. And everyone has sort of their tunnel vision and their blinders on as an expert in a particular field, but you start to lose vision of the human being who is the patient, and then how to have these parts of the system communicate and function together in some sort of harmonious way, which is most valuable to the patient. So as complex as the human body is, and we're sort of mesmerized and mystified by its ability to function as an organism, it occurs to me just now as I'm saying this, I've never really thought of it this way before, but I think this is pretty good. Mark, you're going to like this. The subspecialization and super subspecialization of the fields in medicine have basically mirrored the complexity of the body itself. And so now you have this new organism, which is the medical professional establishment, but it doesn't have a million years worth and many millions of years worth of evolution to develop those seamless, beautiful interconnections between the parts. How the central nervous system makes the little toe move up and down is quite mystical and beautiful. And for the medical establishment to catch up, how does the neurologist speak with the vascular surgeon, who speaks with the lymphedema therapist, who speaks with the wound care center, who speaks with the arterial surgeon and the venous surgeon and the cardiologist to look at the patient's cardiac function and any degree of congestive heart failure, and then you bring in the nephrologist and the BUN to creatinine ratio and kidney function and so on and so forth. The system has become as complex as a human being, which is quite miraculous in its own way, and to be applauded. What we as a species have been able to achieve in terms of understanding each tiny area of the body, but then for us to come together and work in a seamless and efficient way that best serves the real organism, which is the human being and the patient, is an enormous challenge. And it's one that we're all dealing with every single day. So I think that's a fascinating subject and a fascinating observation that I'm taking from this conversation that you all have been having. The other area that I'll touch on that I think is so important, we've gone over again and again that they're not teaching any of this, or very, very little of this, in the medical schools. The complexity of the lymphatic system, lymphatic diseases, the various manifestations of those diseases, how they're related to other diseases, for example, venous disease and phlebolymphodema, or lipedema, et cetera, or lympholipedema. Well, the reason they're not teaching it, quite frankly, is because they don't know it.
Mm.
So when you have a professor who's ignorant of the subject matter, and you don't have yet, this has been one of Emily's battle cries, and I couldn't agree with her more. If you don't have a department of lymphology in the medical school, if you don't have a lymphology residency, if you don't have a lymphology fellowship, where does the expertise come from? If you're going to leave it up to vascular surgeons, most vascular surgeons, it's a rarity to actually see a lymph vessel, and you're like, hey, look at that. Lymph vessel. Interesting. Other than that, it's lymph nodes. And quite frankly, we've historically treated them with, I think, a fair amount of disrespect, and just excised them when they're in the way, and, divided them and moved them, and so on and so forth, when you're trying to get to something important like the femoral artery in the groin. So there's a lot for the teachers to learn before they can pass that knowledge along to the students. And that's one of our huge hurdles to come along to overcome. And that's what you're facing, Nellie, when you deal with surgeons and specialists in various fields. They're like, yeah, just do what you do, and or they're being dismissive. It's because they don't know anything about the subject. It's not that they're don't get me wrong, I know how arrogant physicians can be, and especially surgeons, so some of them are being dismissive and talking down to you, but a lot of it comes from a place of ignorance and fear that they're in uncharted territory, and they don't know what they're talking about, and it puts them into a state of dis-ease, a state of anxiety. So they just don't want to cope with it. And then you touched on another very important subject, hugely important subject, that you touched on sort of tangentially, but it's at the center, it's at the core of this whole problem, quite frankly, in my opinion, which is the subject of compensation. If you can't be compensated, if there's no money in a field, then who is it going to attract? Who's going to want to go into that field? How does that individual pay their bills? How do they pay a staff? How do they pay overhead? I'm talking in a private practice sort of milieu. And if it's a academic or institutional milieu, then the powers that be, why are they going to want to invest huge sums of money to build out programs that have no reimbursement, no compensation, and no return on their investment? And it's not because they're evil capitalists, it's because they're business people and they have a business to run, and hospitals are in many cases already in the red, and if anything, running on fumes financially. So how can you expect someone to do that? Which is why I thought last week's guest, Bill Rapici from Learn, was so interesting, and a very dear friend of Emily's for so many years, because he's started, it seems, to scratch the surface and just begin to make a dent in funding for this very important field. And the funding so far is paltry and ridiculous and inconceivably small compared to other areas, as he was pointing out, that not that they're not important, but where you may only have a few 100,000 patients affected in the country as opposed to 10 million. And the funding from the government, et cetera, is not comparable. So I'm not helping to clear anything up, certainly, but I wanted to at least recap all the problems that face us and then maybe pass it over to you again, Nellie, to see if you have any thoughts on some of those things that I touched on, and maybe point us in some sort of an optimistic direction.
Yeah, I mean, so I'll tell you that my two specialties in physical therapy are lymphedema, and I'm also a vestibular therapist, which is kind of another thing that is not super well known to treat a dizzy patient. And so I don't know what it says about my personality that I want to seek out these things that medical professionals don't know too much about. But
I think it says a lot. I think it says a lot for your personality, quite frankly.
But the other thing I want to talk about is, you talk about the complexity of swelling, and I completely agree with you. Why is someone swollen? But the beauty of what I do, and it's different from what you guys do, but the beauty of what I do is I tell them right away, I'm a physical therapist. I'm here to treat your swelling, and I can make your swelling better. And a lot of it is a frustration. Well, why am I swollen? For the people that you really don't know why they're swollen. And I say, that's above my pay grade, but we're just going to make you better. Now, there are certain things, right? So if they have congestive heart failure, if they have arterial issues or a DVT, I've been in this profession long enough where I could say, look, we've got a red flag here. I need to send them on. But for a person who just presents with swelling, for me, I say, I'm going to make your swelling better. So it is rather simplistic. It doesn't have to be so complicated, as long as I'm not seeing these kidney issues. If I listen to their lungs and they have, crackles, I'm like, oh God, they're in congestive heart failure. You know what I'm saying? Like, if I don't see those red flags, I got a green light. I don't always need to explain why. I know that's frustrating for the patient, but in my career, there really wasn't somebody who I could say, you can go to this person and they'll tell you why. Now we've developed certain things, lymphoscintigraphy and things that might be able to kind of guide them in a better way. But as long as I don't see true red flags, I proceed, and I don't always come up with, oh, I've got to send you to vascular, I've got to send you here. I mean, I could look at them and say, you clearly have a vascular problem, or you have chronic venous insufficiency, or you have primary, just by their history and things. And we could just move on from there. But I often, unless I'm seeing something medically concerning to me, I just proceed. And I don't know if that helps you a little bit. I mean, for the most part, I could just keep going and not make things so complicated.
At VitaSupport MD, we believe in creating the best bioflavonoid-based supplements to support your vitality. Bioflavonoids are found in abundance in nature and support excellent health and wellness. The demands and stresses being put on our bodies in these challenging times are unlike any we have seen before. Support your body with the flavonoids it needs to fight inflammation and oxidation. Unlike other products in the marketplace, VitaSupport MD dietary supplements use micronized flavonoids for optimal absorption and effectiveness. Micronization is an advanced process which creates an ultra-fine powder easily absorbed by the body. At VitaSupport MD, we are passionate about making your good health our life's work.
I want to point out that in my practice, I usually hire not the certified therapist. I am hiring pre-PT, pre-medical students, pre-nursing. I train them, and I am very happy and proud to say we already have few physicians that started in my center, few medical students, and so they are now, John, fully trained in lymphology, which is fantastic. And not only that, but they have also hands-on training in manual lymph drainage. Talking about ignorance, this morning I had a wonderful, sweet 78-year-old woman who just had open a total knee replacement. And when I looked at her and she had the tight stockings on, and I thought, oh my gosh, she is lipedema patient. And she said, well, I always had swelling in my legs. And before the surgery, I asked the orthopedic doctor about the swelling. He said, don't worry about that. Well, guess what? After the total knee, which was not robotically done, she has increased erythema around the knee, increased skin temperature around the knee, and she is so swollen on the right side where she had the surgery. And I thought, usually the orthopedic surgeons that know our area, my center here, they usually send the patients when they have any kind of swelling for therapy and for a pump treatment before the surgical intervention. And now this one showed complete complication, and I just so worried that she's not going to end up with infection in the knee. But this is the medical ignorance, where a patient is misdiagnosed or undiagnosed with lipedema, goes for total knee replacement, and now she has complications. And I hope that this is just a transient complication and not lifelong complication. So we need to teach more about lymphatic disorders, all of the doctors, and so the patients don't end up this way. And so I am very happy to say we have quite a few physicians already who are selecting different types of surgical fields or medical fields. And right now I have one resident who is finishing, and she was trained here. And it's so wonderful to see when they call back and they said, guess what, on the exam I had the question about lymphedema and all this, and we knew it because we learned that here. So we need to teach medical students more and start from even medical schools with lymphatic disorders, lymphology, anything about a lymphatic system, how it works. So congratulations that you are doing such a fabulous job. And not only you as a seamstress, but you are a fantastic therapist. And I'm laughing because when I came to this beautiful country, March the 4th, 1971, my first year is not knowing anything about anything, not having money and not knowing the language. I was working in a sweatshop for 1 year. So I am a seamstress too. So I identify with you.
So Emily, 1971.
March the 4th, 1971.
What a day to celebrate for you and for us, because I think the United States benefited greatly.
It's coming up. It was only a few months ago, okay? It's not, not
a
year.
Nellie, I want to ask you, because the Lymphedema Treatment Act passed, and it's currently in discussions about what to do. So what would be your dreams and hopes for the Lymphedema Treatment Act, or for what we see happen on January 1st, 2024?
You know, I'm sort of a realist about these things. I'm hopeful that this is going to be obviously opening the door to people and granting them access to garments, which is, I think, essentially what it's about. It's about Medicare being allowed to bill for compression garments, which it currently is it can do only in a very limited way. Obviously, it's been 25 years in the making. My concern is we haven't really seen it yet. We haven't seen what the final package was. You know, I'm a real skeptical person, and I'm concerned that they made it more palatable by saying, oh, maybe they're, you know, only going to allow upper extremity. I don't know. We can't really tell what it is yet. I'm also concerned that it's going to be difficult for a place like Oscar and Anna, the private practice, to get good compensation. I mean, currently Medicaid pays for garments. They say they pay for it, but it is almost impossible to find a vendor who's going to be paid $18 for a compression garment. So I hate to be, it was signed, or it's being signed, or it's on someone's desk, and I'm hopeful, but I'm also, I've been in this field enough to know that be careful what you wish for. I don't know. I don't know if the compensation is going to be sufficient enough for vendors to say, okay, yeah, let's work with the Medicaid, let's work with Medicare insurance and try to get these things covered. So I think we'll find out soon, and 2024, I guess, is when it's going to start happening.
Vein Formula 1000 and Lymphatic Formula 1000 from VitaSupport MD are backed by science and sold in doctors' offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
Tell us what you think of lymphedema pumps and how they fit into your practice.
So it depends on the school that you go to, right? So certain schools are so anti-pump, although they're starting to be pulled back into the pumps. I think that during COVID, we saw that when access is limited, a pump can or was providing the only lymphedema treatment that some of these COVID, because of COVID and access, some of these lymphedema patients had. In my practice, it's certainly not. I think people like surgery. People think, oh, if I get surgery, I won't have to do any sort of compression anymore. I'll just, they think it's the answer. And I think it's very important that we approach the pump. And I think the vendors talk also that this is your answer. They're selling a pump. They're it's their job. But I think it's important that we recognize it as a potential tool. I think it becomes, for me and my practice, it becomes way more important when someone is elderly or infirm, so they're not walking. In my opinion, I always say, I would much rather have you put on a compression sleeve and walk around the park for an hour than sit on a pump for an hour. If you have the time to do both, have at it. But walking is always preferred in my eyes.
And educate us on why. Because it kind of gets into some of those principles of complete decongestive physiotherapy, right? With diaphragmatic breathing and muscle. Right. But explain that so that, because that's not my background, and you're going to educate a lot of people listening to this on why that makes a difference.
I think that, first of all, when you move, when you encourage somebody to move, you encourage somebody to lose weight and to stay active. And for all reasons, that's better than sitting on a pump. Okay. And the other thing is, I think the natural muscle pumping action of walking internally is always better than putting on an external force and pushing the skin. That's, to me. Now, of course, when they take that walk, they're going to need to be in some sort of compression, so their skin just doesn't expand and they get, more swollen with walking. But I think we're seeing things, and pumps are being covered by Medicare more than compression. And so I think it's people go where the money goes. And so now there's all these pump vendors pushing pumps because they pay for them more than they'll pay for a compression option. And I think they're selling, I don't want to speak out of turn, but I think they're selling too much. I think they're promising too much. And I currently have patients, I hope I don't get in trouble for this, that are told that they should be pumping for 3 times a day for 3 hours. And if they don't, their lymphedema will get worse. And I can't in good conscience hear that and say, come on, you're going to be 3 hours on a pump laying down? How could that be good for your lymphatic system?
Well, and I would ask where the data is, because I've not
Exactly.
seen an
These
outcome
people are just
study that would,
thrown 3 hours
you know,
of pumping. I think it's a tool. If you're 80 years old and you're not really getting out of bed too much, you're a fall risk, I think it's a great tool just to keep things at bay. But it's part for a young person, for a person who has who can ambulate and has good balance. It should be a minimal part of their day.
and with treating this kind of like a CME event, right? I mean, there's a head and neck pump produced. And then there's the high pressure pumps, and then there's the pumps that are kind of like manual lymphatic drainage, and now there's an ambulatory non-pneumatic
Oh yeah, I've seen that.
device that's on the market that's getting that's got a article in Nature, article in I think it gets back to that education part, because you have to understand the nuances of each pump. And then you have to understand how that incorporates into the patient selection, just to your really excellent point. And it's not a solution, it's a maintenance. And if you're not doing compression and all the other standard of care stuff, the pump's not going to work as well.
And I'll tell you that, since COVID, and I get it, just follow the money. Since COVID, pump vendors are now going directly to vascular surgeons, and so by the time they get to us, they already have a pump. They've already been sold a pump. It's already in the mail, because I think it's been oversold, and I think vascular surgeons are gonna, oh yeah, here's your pump, versus like it's so much more palatable to say, I have a solution for you. Here's a pump that you're going to do in your home, versus you have to go to therapy. When we explain what therapy is, it's not always the most pleasant conversation. It's a lot. It's labor intensive, and it requires a lot of time and energy. So I think the pump, especially with COVID, has been oversold. I hope nobody comes to get me, but I think it has been.
Nobody's coming to get you. I think it's a fascinating discussion, and I think it's a great question mark. But you hear what I said? Question mark. No. You see what I did there?
Yeah, Freudian slip. Wonderful.
It's a double entendre. Question mark. Good. So, but what I want to ask is a couple of things regarding that. As a vascular surgeon, who does prescribe pumps, I think relatively conservatively, but where I think it's indicated, I certainly will. I agree with you. I think three hours a day is, unrealistic for most patients, quite frankly. I typically suggest an hour, but I have heard people suggesting 2 and 3 hours a day. If you have the time and you have the inclination, I guess that could be done. But my problem, Nellie, has been traditionally, and hopefully this show and bringing people like yourself, and my meeting people like yourself and like Oscar and Anna, who are qualified people in my area, the access to care and the access to certified therapists who are knowledgeable is a problem, generally speaking. And also, it's just like any other branch of medicine. I know for a fact, from feedback I've gotten from patients, discussions I've had with therapists, there are a lot of people posing as lymphedema therapists who are not. They don't know, the techniques. They're doing very painful therapies with deep tissue massages and so on and so forth. And then the other aspect of that becomes compensation and payment and the financial end of it. My understanding has been over the years that getting reimbursed, not getting reimbursed from the, I should say, getting coverage from many of the insurers is hard or very limited for a period of time. They might allow a certain number of therapy sessions, but then it ends. So I need to be educated by you on that. And then my other question would be, is there let's say in the state of New Jersey, where we both are, is there a statewide lymphedema therapist society or organization where everyone is working together in unison, just like we have the vascular here? I have right on my desk here, the Vascular Society of New Jersey, looking for their dues. Is there such a society where you all are coming together to have unity and then share that message with those of us practicing medicine and surgery and so forth, to let us know who's qualified, who's well-trained, who's certified, who's in our area, how we contact them, and so forth?
Yeah, so it's a problem. I agree with you. I think there are two ways of determining who's qualified in your area. One is through the National Lymphedema Network, right? So National Lymphedema Network will have LANA certified and I think just regular lymphedema patients. So that's, regular lymphedema therapists. And then the different schools like Norton, who's a Jersey-based school of lymphedema, they also have lists of people who have been trained. I think the problem is that people are trained and it's expensive, and then they go back to their facility and they spend 3 hours, maybe a weekend, saying, teaching other people what they have, and then it sort of gets all diluted a little bit. But certainly we have gotten patients, and Oscar and Anna have gotten patients that we saw from other facilities, and we question what kind of qualifications they have in this. And I would say there's a problem. Yeah, there's definitely people. I will tell you, when you call an office, even for vestibular, if you call lymphedema or physical therapy office and say, is there anybody there that does lymphedema or vestibular? You're going to say, yeah. You're going to say, yeah, we'll figure it out. Yep, we have people here. They just do. So, I'm not doing that, but, and most hospitals aren't doing that, but I think that there is, in these desperate times where our compensations are so low, I think that private practices and other kind of chain physical therapy places are going to have a problem turning patients away. And so then we have these issues with poor treatment. And I think there's also people who would think that because some of my patients are not seen 5 times a week, that I don't do good therapy. Like, I think
Well, again, I think one of the attractions of the pumps is that they seem to be covered without much difficulty. So the patient gets their pump, and then if they use their pump, which I do, I must say I have patients who use it quite successfully, and I've seen good results in reduction of edema. Then there are people who never use it. They get it paid, and then it sits in the corner, just like a lot of exercise bikes and treadmills around the country. I think
there's definitely a place for it. I think it works if you really have lymphedema. If you have, a true lymphedema, I don't think it's going to be the only tool you can use. And you're right, with insurances covering so less, and places not accepting different kinds of insurance, I think you're right. It's a tool. When they say, oh, there's a 4-month waiting list for a lymphedema clinic, they turn back to you and say, what are you going to do for me now? And they say, well, I have this pump. And I get it. It makes sense. But
is there a society? Do you have a lymphedema therapist society in New Jersey?
It's not in New Jersey. It's a National Lymphedema Network. Yeah, national.
But maybe we should have, I know about NLM, but maybe we should have statewide societies headed up by incredible people like yourself, with some of the colleagues that you know and trust and respect, and try to put a network and a society together whereby there's a vetting process through the society so that you could recommend statewide and put your forces together, county by county, or however you wanted to do that, to have a bigger voice and make a bigger footprint. Because somebody like yourself, who's obviously incredibly talented and experienced and well-trained, I mean, if it weren't for this program, I would never know that you exist, quite frankly. And that's why I love this show so much. I mean, I say it all the time. I think people think I'm being funny. I'm not. I know that having had the program, I've learned a lot about this entire field, a lot. I thought I knew quite a bit about it when we got started, but we're not only learning what there is to learn, but we're also learning what the deficits are, where the weaknesses are, where we could do better. And, this is an area where I think we could do better. And I'd be happy to help you in that effort as a vascular surgeon. Who knows, maybe it becomes Mark, this is not a bad idea, maybe a side branch of the State Vascular Society or something like that. That'd be a perfect kind of hand in hand. I'm just throwing ideas out there, but I think there should be a club, there should be a group that, from the South Jersey and all the way to North Jersey, from the seashore to the mountains, you guys start building a network.
And I would certainly say, I think it's a great idea. Certainly, and I just want to bring up American Venous Lymphatic Society, right? Because I think the AVLS has done a great job of going from the Phlebology Society, purposely putting in the L to highlight lymphatics. And, I applaud that whole group and Dean Bender and the leadership of really starting to get lymphatics on the forefront for educating physicians like me, who for the vast majority of my career just had no idea what was going on.
Well, we've got a lot of work to do. We're coming to the end of our time here. We're going to have to wrap it up as usual. I wish we could go another hour. And as usual, we're going to have Nellie. We're going to offer an invitation to come back when the schedule frees up again. But fortunately, we have so many great people coming. This was a great introduction by Oscar and Anna Pizzoli from Omni Therapy, and we thank them for that. Emily, any closing remarks?
Well, I want to thank you very much, congratulate you, first of all. And I think it's a great idea to have a local network. And you know what, I have seen patients from certified therapists who are doing gross mistakes, and I'm seeing patients who are being treated by massage therapists. So I think not only we should start having some discussions, but also some courses or advanced courses or debates how to deal with more challenging patients. But overall, I am congratulating you for your fantastic work and continue.
Why don't you share with our viewers and listeners, because this is a big part of the show, is letting people know where you are, who you are, how they get in touch with you.
So I currently work for Atlantic Health, which is it's an umbrella of Morristown and Overlook hospitals in New Jersey. And we have different satellites. I'm at the Clark satellite, but we have lymphedema clinics in Cedar Knolls and in New Providence as well. So, and I'm the only person at the Clark site, but there are 5 or 6 therapists in the other sites. So we are well spread out. I mean, I'm very proud of the work I do here and of the work I've seen so far. So it is a really good potential source for you guys. And I hopefully have decreased the waiting list a little bit. That was what I always try to do.
Wonderful. Are you still doing any vestibular work? Because I have a patient to refer to you right away.
We, because of the amount of lymphatics that lymphatic patients we see, I don't do vestibular work, but at Cedar Knolls, we do have a vestibular clinic. I hope to start doing vestibular again. I was doing it by Oscar and Anna too.
Wonderful. Is Cedar Knolls anywhere near Montclair?
It's more near Morristown.
Oh, okay. All right. Very good. Well, that's all good information to have. I thank you so much for being on the show, and I'm going to before passing it back to Mark Melin, I want to mention again, Dr. Iker, please, for our listeners, give the contact information for your practice there in Santa Monica, California again.
Well, it is Lymphedema Center in Santa Monica. I am Dr. Emily Iker, and Google posted me as a physical therapist. I'm sorry to disappoint them. I am not. I'm just a physician and a director of Lymphedema Center, and has been here for now 30 years. So my phone number is 310-829-7472. And the website is lymphedemacenter.com, and we are in Santa Monica, California.
Beautiful. One other question for you, Emily, because I'm seeing a lot of patients who I feel could benefit from your help. Are you doing any virtual consultations for people who are outside of the general California, Santa Monica area?
Not really. In desperate situation, I can do something, but when you see the patient, you really have to put the hands on and feel the tissue. And when I see first consultation, I always do ultrasound study, and it's impossible to do it virtually. So with that, I can see the dermal changes, subcutaneous tissue changes, fascia changes, and so on. And that will confirm my clinical presentation and clinical diagnosis. So I combine those two together. And on quite a few instances, I look at the patient and they were quite skinny legs, and bingo, there was lymphedema, true hyperechogenic tissue distally. And so it's better to have, and I enjoy doing this and confirming the clinical assessment with ultrasound study.
Fantastic. Great information. And many of these things, we hope in the not so distant future, we're going to have our own workshop and seminar through the LymphCast program, and we're going to be obviously featuring Dr. Iker and some of these amazing techniques that she has pioneered, especially in the evaluation and utilization of ultrasound for looking at the dermal elements, subcutaneous elements, fascial elements, etc. And when that time comes, we're going to invite incredible people like Nellie Bloom,
And you and Mark,
and of course, the great Mark Melin. So with that, I'm going to pass it back to you, Dr. Paul, and why don't you sign us out?
All right. Thank you very much. Glad to have you with us, Dr. Bloom. Thank you for everything tonight.
Thank you so much.
All right. Let's thank our panel as well from California, Dr. Emily Iker. Thank you, Dr. Iker, once again for everything you've done on this show.
thank you, and thank you for this wonderful presentation today to all of you.
All right. And from Minnesota, Dr. Mark Melin. Thank you for everything, sir. Another fine job as always.
You know, as a simple wound guy, I would just advocate that every wound clinic get associated with really good certified lymphedema therapist and make the connections. And, you know, Nellie's just helped us to educate that critical nature, because it does accelerate wound closure and decreases recidivism rates. So, Nellie, thanks for being with us today.
Yeah, thank you so much. It's great to be here.
All right. And the founder of Vita Support MD, makers of Vein Formula 1000, Lymphatic Formula 1000. From New Jersey, physician surgeon, also the creator of this show, Dr. John A. Chuback. Thank you, Dr. Chuback, for everything.
Oh, it's my pleasure. And that brings to mind, we're going to have to send Nellie some samples of the lymphatic formula and some of the great science that our dear friend, Dr. Monika Gloviczki, who couldn't be here tonight, traveling to Europe, teaching as always, but some of Monika's science, and see if she finds a place for it in her practice, and I'm sure that she certainly will. So that'll be another opportunity for us all to connect. And Paul, as always, thanks for hosting. Look forward to seeing you again soon.
All right. Thank you very much. And again, this has been a LymphCast, episode number 21. We thank you for joining us. We'll see you next time for a LymphCast, episode 22. Have a great day.